have with us today one of our esteemed consultants to share with us her experiences and knowledge on this particular topic. Now, before we begin our program, let's center ourselves in reflection and gratitude. I invite you to join me in this opening prayer.
Let us put ourselves in the presence of the Lord. Our Heavenly Father, we offer you our thanksgiving. We thank you for everyone gathered here today to walk with you. May we ask you for your blessings and guidance so that the activities set for this undertaking be successful. We ask you to open our eyes to see the wonderful things from this activity. We ask that you open our ears so that we may retain the invaluable knowledge. Open our minds for us to think wisely. Put us with understanding, cooperation, and peace in fulfilling our responsibilities. Open our hearts so that we may receive your everlasting love, and open our spirit so that we may know that you are with us all throughout the day. We ask all this in the name of Jesus Christ. Amen.
Now, as we start this program, it is an honor to have with us today our beloved and esteemed consultant, Dr. Maria Teresa Tricia Bautista, who will be sharing with us her opening remarks and set the tone for this thought-provoking lecture.
Good day and happy Saturday to all. In behalf of Quirino Memorial Medical Center, I warmly welcome you as we embark on the third year of this series designed to equip you with the knowledge and skills to manage diverse medical conditions effectively. Today, we turn our attention to a prevalent yet often understudied phenomenon, the nosebleed. While seemingly unassuming, nosebleeds can elicit significant anxiety in both patients and the healthcare provider. The diverse etiologies and potential complications warrant a thorough understanding of evidence-based management strategies. This session is precisely dedicated to that endeavor. And so I thank the Department of Otorhinolaryngology, Head and Neck Surgery for their collaborative efforts to bring this into focus. So let us engage in today's webinar and emerge fortified with the essential clinical tools. I trust that this conference will prove both informative and enriching. At sana hindi tayo mag-nosebleed. So thank you for joining us. Magandang umaga po. Good.
Now, please join me in welcoming our distinguished speaker for today's forum on nosebleeds, Dr. Julie Ann M. Lopez. With her expertise, we're set to gain valuable insights into understanding, preventing, and responding to nosebleeds.
Morning, everyone. Let me just share my screen. Okay, can Can everybody see my screen, my slides? Dr. Ardonia, may you check, please? Or Dr. Macabasco?
Yes
po,
po,
Dr.
ma'am.
Okay, can everybody hear me?
Yes po, ma'am.
Yes po, ma'am.
Okay, thank you. I think others are having issues with your audio, but if I'm heard sa tingin po, check your device. Maybe the audio is not on your device, no? So for those ready to hear the lecture, here it is. So good morning. I'm just gonna fix this. Thank you. My name is Dr. Julian Lopez. I am a medical officer 4 of the Department of Otolaryngology, Head and Neck Surgery, and I'm here to discuss about our topic today: nosebleeds, its causes, and the first aids for this phenomenon. So, nosebleeds are the most common otolaryngologic emergency. It can be serious, it can be benign, presentation in ER, in clinics, in the hospital, but it is very prevalent. And yes, as Dr. Bautista said, it will cause anxiety for both the patient and, of course, us. It is said that it occurs in a small vein along the lining of the nose when it bursts, and which I will discuss further. And usually it affects those of ages less than 10 years old or more than 35 years old. And they're said to be a predilection more of male to female in relation to the females having their estrogen having a protective effect on the nasal vasculature. So it is said that it's more common in males, but there's no studies that says it is predominantly male. And majorities of these cases, the nosebleeds, are due to local mucosal trauma. But I'll expound on this further. So for the causes of nosebleeds, I'll be discussing a few. The first few are, of course, the most common primary mucosal problems, where usually in relation to irritation, the use of CPAP or the continuous positive airway pressure, which is sometimes used by those with OSA or obstructive sleep apnea, and of course, any structural deformities such as septal deviation or septal perforation. This will cause nosebleeds. Now, the next one would be any general systemic problems in the patient, most especially hypertension. Most of our cases in the ER that we've seen have been the nosebleeds have been related to increase in BP. So if it's not controlled, nosebleeds are quite common in these patients. And other causes are atherosclerosis, use of antiplatelet or anticoagulative agents such as aspirin and clopidogrel. But these are maintenances. So for those patients who have maintenance such as this, as aspirin or clopidogrel, it is warranted that they should be watching out for nosebleeds. And of course, other diseases such as any chronic disease, such as chronic liver disease or chronic kidney disease. Other causes would be any medications or drugs such as topical nasal steroids, saline sprays, and cocaine abuse. So all these three medications should not be used disparately, or it has to be your doctor has to have an approval for the first two medications. Now, infections can cause nosebleeds as well. Any viral, bacterial, or fungal rhinosinusitis would cause nosebleeds. Inflammatory causes are such. So I will not expand on this. Other causes are those neoplastics or the tumors, no? So, of course, any hemangiomatous tumors, these are vascular tumors, especially when it's within the nasal cavity. Any manipulation to this, any trauma to this would cause bleeding. Pyogenic granuloma, which is another kind of tumor, can cause bleeding. Papilloma also. Now, juvenile angiofibroma, the fourth bullet, these are more commonly seen in young adolescent male, which causes chronic nasal bleeds. Okay, so if there's any presentation, any patient that you have in your clinics, adolescent male with nosebleed, you may consider this. And then, of course, malignancy such as carcinoma, sarcoma, or lymphoma, they cause nosebleed. nosebleeds. Now, any hematologic diseases such as hemophilia or the von Willebrand disease can cause nosebleeds as well. One of the most other common presentations that would cause nosebleed, of course, is trauma. Nose blowing or severe nose blowing, secondary to maybe itchiness or anything, any source, can cause nosebleeds. So you have to be careful in blowing your nose, because you might burst the small blood vessels that I have said that are present inside your nose, would cause these nosebleeds. And then, of course, facial or skull-base fractures can cause nosebleeds. So any trauma within the face, so vehicular accidents, patients who are subjected or presented with vehicular accidents would cause nosebleeds. Foreign body in the nose can cause nosebleeds, especially when it is tried to be manipulated or extracted, no? So you can injure the mucosa inside the nose. So this occurs mostly on young patients, no? Because they are the ones who usually put something inside their nose. For the adolescents or maybe adults, those who have their piercings in the nose, if the person who does the piercings nicks any of the small vessels within the nose, that would cause nosebleeds. And of course, any iatrogenic cause such as surgeries within the sinus area, NZT placements for those who need to have OF feeding, or nasal packing actually can cause nosebleeds as well. So for nasal packing, I'll be discussing this in the management part. So nosebleeds or epistaxis has two types, anterior and posterior. So I'll be discussing first the anterior. So anterior epistaxis, according to DOH, these are definitions given by the DOH Public Health Advisory. It affects the lower part of the wall that separates the nostril. It is called the septum, and here is where the blood vessel are contained. Bleeding starts usually from the front of the nose and then flows outwards, and this actually happens when the person either is sitting or standing. And mainly, it may occur during very cold weather or dry season. Now, according to our textbook, majority of this case, of the epistaxis cases, are usually anterior epistaxis, about more than 90% of the cases. And actually, the blood vessel that we're talking about here, hopefully you can see my pointer. These are the blood vessels that is the cause of the anterior epistaxis, which is called the Kieselbach's plexus or the little area. It is located anterior at the anterior nasal septum, and it is a confluence of the branches of these four following arteries: the anterior ethmoidal artery, the sphenopalatine artery, the greater palatine artery, and the superior labial artery. So you can see that four arteries are very responsible for the nose bleeding. So it is quite a quite large source of blood vessels, a rich source of blood vessels to have this anterior epistaxis. Now, to discuss posterior epistaxis, again, this is from DOH. They mention it as bleeding starting deep within the nose, and it flows back to the mouth and throat. So kung kanina po, it flows in front of the nose. Now, usually patients would feel this posteriorly, or they might swallow the blood immediately, no? So it happens when the person is also sitting or standing, and usually, according to DOH, it occurs to older generation and those with high blood pressure or injuries, no? So this would be the picture, no? So this one is a picture of an endoscopy. So this area is already the posterior or the most posterior portion of the nasal cavity. Here is the choana in the anatomy. And then you can see here, these are the confluence of blood vessels. No, so typically this posterior epistaxis arises from the branch of the sphenopalatine artery. But if the anterior epistaxis, we have Kieselbach's plexus. Now in posterior epistaxis, we have Woodruff's plexus. It is a prominent network of arteries visualized posterior to the inferior turbinate root, which is this, and the horizontal part of the middle turbinate. Although this is quite more advanced for this is actually for the people who understand endoscopy, no? So just to be for people to just to be able to visualize this. So this is your Woodruff's plexus. Okay, so that's for the anterior and posterior epistaxis. Now I'll be showing this infographic where again this is from DOH. Where they differentiate anterior and posterior nosebleed. So anterior happens as bleeding will start in front of the nose as opposed to posterior that starts deep within the nose and usually occurring to dry season or very cold weather, but with posterior epistaxis usually is related to any comorbids with the patient, so probably with high blood pressure. And it affect in anterior epistaxis affects the lower part of the wall or the septum, and the number 4 part of this infographic is very important. If you have identified the patient to have posterior epistaxis, DOH actually recommends to have some immediate medical help. Okay. So now we have identified the causes and we have differentiated the 2 types of epistaxis. Now we go to the management. The first part of the management is the conservative management. So mostly ito po yung pwedeng gawin natin immediately once the patient is presenting with epistaxis. So put pressure or apply pressure to the soft tissue or cartilaginous portion of the anterior of the nose and hold it for at least 15 to 20 minutes. And then you have to have the patient tilt his or her head a little bit forward. Ito sabi, chin to chest in an upright position. So in this picture on your right, you can see that the correct position is this one, and not have the patient lift his head up or lean back or lie down. Now, ice packs are very much helpful. You can put actually it on the forehead or maybe at the back nape of the neck. And if you're in setting of a clinic or any infirmary or anything like that, if you have available oral tranexamic acid, it may help. If the patient is able to swallow. So you have to assess the patient first, of course. Assess the vital signs, his blood pressure, heart rate, any breathing problems. If the patient has all that, I suggest that the patient has to go to a very higher hospital. So this is a picture depicting on where to pinch the nose. So it is important that as you can see, it has to be pinched at the lower part of the nose, and the nostrils have to be completely adjacent or at least pinched against the septum, no? So hindi po dito sa taas, hindi po sa gitna, but dyan po sa baba, because that will be the help for the digital pressure. Ito po yung tinatawag na digital pressure to be able to help with the first aid of epistaxis, no? So you have to hold this for at least 15 to 20 minutes, and if it and after 20 minutes, if it stops, then stabilize the patient, monitor the patient for another 15 to 20 minutes. If it doesn't stop, repeat the process at least 2 to 3 times. If it persists, you have to refer the patient. Okay, so again, another infographic from our DOH. So first, when you're presented with a nosebleed, whether you're the patient mismo or you are presented with a patient who has nosebleed, first thing to do is to calm down. Because like we said, high blood pressure can lead to epistaxis. So you have to calm down, have the patient sit down with the head slightly forward, keep the head above the chest, and then do the digital pressure, thumb and index finger squeeze together the nose. Not have the patient lean back, and don't blow the nose. Don't blow your nose or don't bend over. Okay, so that's from DOH na mismo. So another form of management, conservative management, is the application of topical vasoconstrictors. Now, one example is oxymetazoline, where it is usually in a preparation of a nasal spray, such as on the picture on your right, and you have to spray it on the bleeding side. If you have identified that it is a unilateral bleed, meaning one side lang po yung nag-bleed, either right or left, you spray it before you hold the pressure and have the patient have his head tilted forward. Now, if you have to continue giving this oxymetazoline, you have to limit it for at least 3 days or less. So maximum would be 3 days of giving the medication to be able to minimize the risk of rhinitis megamentosa. Now, this is a phenomenon where the patient will have rebound congestion. So, nawala po yung nosebleed but nagbara po yung ilong. So, yun yung magiging problem. So, it has to be less than 3 days lang po. Another form of management of nosebleeds or epistaxis is the nasal packing. Now, these are commercially available. The prepared nasal packs. These are the absorbable and the non-absorbable packs. Now, the absorbable ones are made of synthetic polyurethane or hyaluronic acid, and it usually breaks down within a week of placement. Now, there are non-absorbable packs which are made of at least polyvinyl alcohols. These usually stay inside the nose after you control the nosebleed for at least 3 to 5 days, and it has to be removed in the clinics. The proper removal has to have a preparation, and it has to be sprayed on while you're removing it. But there's the next picture. So ito po yung picture where it depicts before it inflates. So this is the moment where you insert it inside the nasal cavity. Ito po is the half of the nasal cavity, and then it would inflate like this inside the nose, relieving the nosebleeds that is presented to you. Okay, ganyan po siya. So it doesn't return to the normal shape. So when you remove it, you have to really be careful because it might cause another bout of nose bleeding. As I said a while ago, it is also a cause of nosebleed. No? So another form of nasal packing is your posterior nasopharyngeal pack, where you use a Foley catheter, at least 12 or 14 French Foley catheter, and then you insert it within the identified area of bleeding, whether right or left, as this picture nasa left po siya. Right nasal cavity, and then you have to have the patient open his mouth to be able to see the distal tip, meaning yung dulo po ng Foley catheter, dun sa area po ng bibig, as you see in the picture, and you have to inflate it at least within 5 to 10 millimeters of the balloon, and then to be able to occlude yung pinakita ko po kanina na area kung saan nandun po yung source of bleeding for posterior epistaxis. Now, this posterior nasal pack is reserved for if you have identified that it is a posterior epistaxis. Now, you can add a anterior nasal pack if there are trickling nosebleeds after you put the posterior pack. Now, when you have a nasal pack, you have to have antibiotics, especially for the ones that are non-absorbable. Or like in the posterior nasal pack, it has to have to be removed. No, so you have to give systemic antibiotics to avoid opportunistic sinusitis that can lead to staphylococcus infections. No, usually you give at least 1 to 2 weeks of clindamycin or trimethoprim sulfamethoxazole while the nasal pack is in place. So usually naman we don't prolong the nasal pack inside, but if the epistaxis is not controlled between this moment, it's better that you refer the patient actually to the tertiary hospital. Now, this algorithm is quite busy, but I just want the audience to concentrate on these 3 boxes. Now, these 3 boxes, as in relation to the topic of this lecture with the first aid, you have to understand that when a patient is presenting with epistaxis, of course, the ABCs are important: the airway, the breathing, and the circulation. If all are not in a stable manner or stable situation, refer the patient immediately. Pero have the patient have at least a digital pressure just to be able to transfer the patient. And if in your clinical setting, if you have access to fluid resuscitation, do so, especially for massive epistaxis. And then if you have laboratories, maybe you can do any labs like ICPC or any screening. Check your vital signs, especially the BP, because the BP, and I will add to this, the heart rate can prolong the episode of epistaxis, even though it can be controlled immediately, because like I said, hypertension can cause nosebleeds. And then any underlying cause of the bleeding has to be treated. If you have the facility, if you can suction any clots, to be able to identify the source of your bleeding. That is actually the important part if you're going to use any suction, because the goal is for you to at least identify where the epistaxis is coming from. Now, the third box is said, like I said before, for the management, nasal packing, whether dissolvable or non-dissolvable, and then as I said, slide back, prophylactic antibiotics, and then if it is managed and your on that setting, you can keep the pack for at least 1 to 5 days. With us, it's mostly 3 days lang po, and then but of course, it depends on the severity of the bleed. Now, if all of this are unstable or the epistaxis is not controlled, the other parts of this algorithm can be managed with a tertiary hospital. Okay, so I think that would be my last slide. These are my reference, and thank you for listening.
Thank you po, Doctora, for that very insightful lecture. Now, anyone from the audience po who have any questions? So we have one question from the group chat po. Doctora, does EpiPax work daw po?
Yes, EpiPacks work actually, but you have to be able to properly place the pack. So I think what the yung nag-question sa atin is, I think the gauze pack is what he's trying to say, no? So those are strips of gauze na embedded with epinephrine, no? It works, but it has to be properly placed. So you have to visualize it kung kaya ng institution na may endoscopy, it has to be an endoscopic guided, or at least an anterior endoscopy. Meron dapat nasal speculum, and you have to have your light source. So it works, yes, but it has to be properly placed.
Thank you po, Doctora. And thank you po for that question. Another question po from our group chat. Same daw po ba, Doctora, ang management sa adult at sa children?
That's a good question actually. So my lecture is actually more adult based, no? So for children kasi, the best actually management is still digital pressure lang muna. Kasi any manipulation inside the child's nose can cause more bleeding. So hanggang digital pressure lang. And then if it persists, refer the patient to a higher institution. Kasi it has to trained personnel na dapat if ever yung maglalagay ng nasal pack. Kasi mas friable or mas sensitive kasi yung mucosa nila or yung lining ng loob ng ilong. So it's best na digital pressure actually works for children kasi most of the time anterior epistaxis lang naman sila. Hindi sila madalas nag posterior epistaxis. So no need madalas for that. So digital pressure actually helps.
Thank you po, Doktora. Another question, ano daw po kaya, Doktora, ang cause ng pagdurugo ng ilong na kung tawagin sa Tagalog ay binabalingoy-ngoy, especially kung mainit ang panahon?
Yeah. So sa lecture ko, no, so most of mucosal irritation yung cause niya. So if your nose is quite sensitive actually to dry weather, katulad dun sa infographic ng DOH, actually any dryness dun sa lining or dun sa balat sa loob ng ilong, sensitive po lahat nung nakita yung maliliit na blood vessel dun. So maliliit na singa o kaya nakuskus nyo siya, nagtanggal po kayo ng anything sa loob ng ilong, magdudugo po talaga siya. So, may mga pasyente po na mas madalas magganon kasi mas dry po yung loob ng ilong nila. So, yun actually yung cause. So, weather actually is very related sa nosebleeds kasi ang ilong natin, 'di ba, dyan tayo humihinga. So lahat ng hangin na papasok sa ilong dadaan, dyan nag-filter. So kung mainit, o kaya yung humid, yun, magkakos siya ng, kumbaga, kung mabilis mag-dry yung loob, mag-i-irritate talaga. It would cause bleeds talaga. So it's part of the common causes actually po of nosebleeds. I hope that answers the question.
Thank you po, Doc. Another question po, are all those medicines daw po ba ay over the counter and can we buy them anytime?
Unfortunately, I think tranexamic acid lang, which I mentioned sa lecture ko. Yun lang yung I think pwedeng over the counter. The oxymetazoline, you have to have it prescribed. So, yun lang yung if ever yung pinaka-available for over the counter.
And Doctora, can oxymetazoline be used for patients with hypertension po or high blood?
Yes, okay, good question. For those, kasi di ba vasoconstrictor siya, as much as possible, ayaw mong gumamit ng any vasoconstrictor. Pero if it's like just for the digital packing, usually 1 to 2 sprays lang yan. Pero you can, monitor the BP. If it shoots up after mo magbigay, bawal na ulit. Just continue with the digital pressure. Tapos, I guess, if the patient can take any antihypertensive meds, yun yung importante. Especially if the cause of the bleeding is narrowed down to hypertension.
Thank you po, Doc. And there's another question po.
Sure.
Where do we place the ice packs to control the bleeding? Where exactly po siguro, Doktora? If sa forehead or sa...
Okay, so different literatures say mga different things. Pero in general, sa noo po, dito po pwede ilagay or directly dito po sa bridge ng nose. Or kung hindi kaya dahil naka-digital pressure, naka-ganun po, pwede po sa batok. And then, alternating po siya between at least mga 5 minutes kasi syempre irritant yung cold. Kung direktang ice po yan nakalagay sa balat, masakit. So, mga 5 minutes here, 5 minutes at the bridge, then 5 minutes po sa batok. Para hindi naman ma-irritate yung skin ng pasyente.
Thank you po, Doktora. This next question po, common misconception din po, no? But
yeah, sure.
It's good to address this po. Ang nose bleeding po ba ay possible cause po ng cancer ng nose?
It's a presentation. Ibig sabihin kasama siya sa pwedeng sintomas ng hindi siya yung cause. Kumbaga, meron dapat na pinagmumulan yun. Parang like I said in my lecture, the tumors or the neoplasm, dun nanggagaling yung dugo. So, before pa, kumbaga, siya yung parang magsasabi na pwedeng meron. Pero not always. Pero yun nga, if it presents with that, syempre, lalo na pag may nakita po kayong parang bukol sa loob, pag sinilip ninyo, it can cause. Pero yun nga, wag din na pong galawin, like I said, kasi meron po yung mga vascular lesions na isang dut-dut mo lang, dudugo, na naman, mas malakas po yun. So, best pag may nakita po wag na pong galawin, refer na po agad sa higher hospitals.
Thank you po, Doktora. Some of the questions po medyo nag-overlap naman na po.
Yeah.
Sorry, I hope no one gets offended kung hindi na matanong lahat. Pero I think there's another question po, Doktora, that's important to address. Yung bakit daw po kaya pag nagkaka-high blood pressure siya, nagno-nosebleed po siya? Normal daw po ba yun, Doktora?
Well, I won't say it's normal, but it's expected na lang. Yun na lang yung siguro proper term. Like I said, di ba, when sa lecture, number 1 siya dun sa mga general systemic causes ng nosebleed. So, those, di ba, ano ba ibig sabihin ng high blood? Tumataas yung pressure. So, yung pressure, tumataas sa mga blood vessel. And as you saw kanina sa lecture, may yung mga maliliit na blood vessel are sensitive to high blood pressure. Mabilis po yung mag-burst. So, any presentation na let's say nasa 150, 100, kahit 150, 90, minsan nga kahit 140, pag hindi yun yung normal duty ng pasyente, and it would cause talaga po. So those the causes of or the blood vessels that are related to your epistaxis are very small and very thin. So any burst of high blood pressure po talaga, I won't say it's normal. That's it's expected. If you have high BP and then biglang nagdugo, you can actually relate, but not always. You have to you have to see the patient holistically. Kasama siya sa i-consider mo na cause nung nosebleed, especially for adults with hypertension.
Thank you po, Doktora. Okay, so there's another question din po. Doktora, this patient po, may amoy daw po na nanggagaling sa ilong.
Yes.
Bukod sa nose bleeding din po. Occurred 3 to 5 days ago daw po.
Okay.
Yan.
May age bang sinabi yung nagtanong? Kasi
wala po, Doktora.
Kasi pag sa bata yan, tapos mag-isa lang na, let's say, isang ilong lang, kanan or kaliwa lang yung may lumalabas ng mabahong amoy, madalas po yan, ibig sabihin, yung batang yun, may pinasok po sa loob ng ilong. And then, irritated na po yung loob ng kumbaga yung balat sa loob, kaya nagsastart na po mag-nosebleed. I suggest ipatingin nyo na po siya kasi baka mamaya mayroon pong foreign body na naisuksok sa inyo. Yun po ang madalas kapag sa bata. Now, in adults, you don't usually expect na merong foul smelling. Medyo magko-consider na po tayo dyan ng mga tumors, ng mga ganun. Kasi I don't think, or at least personally, I haven't seen a adult patient who willingly placed a foreign body inside his or her nose. No? So, pag sa adult, tapos yun nga, pwedeng actually, pwede pa rin siyang fungal infection sa loob. Pero yun nga, if it's presenting with foul odor, especially unilateral, meaning isang side lang po yung meron, patingin yun na po. Mas maganda po ENT na po yung titingin. Para at least masili po namin ng maayos. For both patients, for both kinds of patients, bata sa
Thank you po, Doktora. So some of the questions here have already been answered earlier po. No? Siguro ito, important din po to address lang. Advisable daw po kaya sa buntis yung mga na-mention na gamot.
Yes. For pregnant patients, actually, meron din silang predilection to nosebleeds, although not always. I would suggest to siguro wag na lang agad-agad magbigay ng gamot because digital pressure is actually can manage the almost 90% madalas yan. Digital pressure can help, no? So when it comes to the mentioned medications kanina, for pregnant ladies, siguro wag na lang po muna.
Thank you po, Doktora. Doktora, pag mainit daw po ba, sorry, this was already answered earlier. Eto na lang po, any vitamin supplements po, Doktora, para ma-avoid ang madalas na pag-nosebleed?
Well, vitamins essentially, it's more of for, resistensya, di ba? So, actually, wala naman pong sinasabi, or at least sa mga literature na may nabasa natin, there's no quite say na they can prevent. It's more of para lang din siguro maging healthy yung buong katawan. So, I mean, there's no harm in taking vitamins, let's say vitamin C or anything like that. But there's no specific mention na makakapag-prevent sila ng episodes of nosebleed. But yes, I guess because it promotes healthy skin, healthy lining of the mucosa, yung mga ganon, I guess it's okay na we can advise. But I won't say that it can prevent. Yung baga hindi siya pang iwas, kumbaga. More of ano mo lang na magiging healthy yung katawan. So pati yung loob, yung balat ng loob ng ilong magiging healthy. So I guess it can be given but it's not for prevention.
Thank you po, Doktora. Ang pag-vape daw po ba or siguro smoking na lang din po in general,
Yes.
does it cause nosebleeding din po or does it increase the risk for nosebleeding?
Yeah, the last part actually of what you said is more accurate. It increases the risk for nosebleed. Kasi number one sa causes ko kanina is mucosal irritation. Smoking, actually vape is still smoke, di ba? There's still some smoke, especially can irritate. Kahit sabihin natin parang menthol yan or anything which is actually I don't know about because I don't vape, I don't smoke. Pero kasi it still irritates yung laman ng loob ng ilong and also dries the mucosa of the nose. So any irritation, any dryness can lead to nosebleed. So actually it's related.
Thank you po, Doktora. Okay. Sige, some of the questions have been answered already. Siguro, we're down to our last question po.
Okay.
This is a common question, Doktora. Ang stress po ba nakaka-cause din ng nosebleeding? Siguro yun po. Just
Okay.
to
So,
summarize lang everything, yung causes of nosebleeding po.
yeah. Well, stress, ganito na lang siguro po kasi ayoko na pang mag-delve in doon sa mga causes ng stress. It's more of what does stress do to the body, di ba? It causes increased heart rate and increased BP. So, di ba sabi natin kanina, any cause of increased BP can cause nosebleed. So, if your stress causes you to have high blood pressure, it would have you on a higher risk of having nosebleeds. So, hindi siya direct relation, pero kasi it affects the stress affects the body in a systemic way na in relation to your heart rate and your BP. So, pag ganun kasi, yun yung magiging parang sekwala niya, doon din tutuloy, di ba? So, kumbaga, lessen the stress para hindi tumaas yung BP.
Thank you po, Doktora. So that's it. Thank you po, everyone, for your active participation in our lecture for today on nosebleeding. Thank you rin po, Dr. Julianne Lopez, for a very informative lecture po and discussion. So we hope that everyone would be going home today with valuable insights and knowledge, and that everyone would know how to respond effectively when needed in cases of nosebleeding, whether kayo po mismo or any of your loved ones. So again, thank you on behalf of the Department of Otorhinolaryngology, Head and Neck Surgery. Thank you for your attendance and participation in today's lecture.
Thank you, everyone.
Lingkod sa kapwa, ang pangunahing tungkulin. Mahusay na programa sa pangkalusugan at iba yung pagkalinga. Mayaman man o mahirap, ay paglilingkuran ng sapat. Anumang sakit o malubhang karamdaman ay bibigyan ng tiyak na lunas. Mula ngayon hanggang sa kinabukasan, tungkulin ay buong pusong gagampanan. Ito ang tapat at tanging sandigan. Sa QMMC ang bayan ay paglilingkuran. Ito ang aming tanging layunin, mahusay at ligtas sa pagamutan, makabago at wastong kasangkapan. Mga kawaning may sapat na kakayahan. Mula ngayon hanggang sa kinabukasan, tungkulin ay buong pusong gagampanan. Ito ang tapat at tanging sandigan. Sa QMMC ang bayan ay paglilingkuran. Mula ngayon hanggang sa kinabukasan, tungkulin ay buong pusong gagampanan. Ito ang tapat at tanging sandigan. Sa QMMC, sa QMMC, sa QMMC ang bayan ay paglilingkuran.